about any consultations, we also have a ton of informational content there. We have these live sessions recorded that you can go back and view at a later date. So today we are going to be reviewing when can you safely resume exercise after surgery. There's a little bit of different rules for depending on the procedure that you had done, but a lot of overlapping things to keep in mind for those different procedures and when you can get back to surgery. The first thing that you need to think about is just take it easy after surgery. A lot of people are in a rush to really optimize, maximize their new body after surgery. You just need to take time to rest and recover. That's really important for the initial few weeks after surgery. So just tone it back a little bit. Keep in mind that you're gonna have plenty of opportunities to exercise and get back into it a few weeks down the road, but to minimize complications, you just really need to take it easy and listen to your body those first few weeks after surgery. So what does that really mean? So basically, no exercise for the first 2 weeks after basically any surgery that we do. And then after that initial 2 weeks, if you're feeling great, you're moving around, pain isn't too bad, if you want to start very gentle return to light cardio like walking or sitting in a stand-up or in a seated bike where you're not leaning forward and holding on to something, you can do that. So low impact cardio can start as early as 2 weeks after surgery. Obviously, if you just had a BBL or something like that where you need to stay off of your bottom, you can't sit down on any stationary bikes. And then we start getting into the different procedures and where things vary a little bit. So if you had just a liposuction procedure at 2 weeks, if you're feeling great, and as long as you're able to wear your garments and get your massages and do all those things, I am personally okay with you returning to just about any type of exercise you want to do at that point. Keep in mind you may have increased swelling after exercising or vigorous exercise, and ease back into it, listen to your body. Now, where this changes is if you had a BBL, you really got to think about staying off of your bottom, so we're maximizing and keeping as much fat as possible that remains viable during the recovery phase. And now moving into something like a mommy makeover where you had an abdominoplasty, especially anytime we tighten the muscles, which most patients get muscular plication with their abdominoplasty, you really need to take it easy with any heavy lifting for the first 10 weeks after surgery. Reason being is we repair your muscles from your xiphoid process down to your pubic bone, and if you get too active too soon, you can pop that big suture that we put in there to tighten up your muscles. So we need to allow your body to scar in that tissue to really make it a strong repair, and then you can get back into it. And a lot of women find that after they've had their muscular plication done, their core is much stronger than before surgery, because before everything was loose and it just wasn't as strong as before your pregnancies. And afterwards you can really get back into it, but you need to wait at least that first 10 weeks before you start doing core exercises or heavy lifting with exercises that engage your core. For breast surgery, we really need to think about the type of breast surgery you had. If you had just a breast lift or a breast reduction without any implant placement, most of those patients can really turn back to full activity at around the 6-week mark if they have no little wound healing issues. As long as there's no wound healing issues at 6 weeks for my patients, go back and do whatever you want to do. If you had breast implants placed, then we have to think about where those implants were placed. So for some of my breast augmentation patients, I do subfascial breast augmentations, which means above the muscle, but below the fascia. And those patients, they really have no limitations once they fully recover from their surgery in terms of engaging your pectoralis muscles or your chest muscles. So things like push-ups, bench press, burpees, all that kind of stuff. If you had a subfascial breast augmentation, you can return to all that stuff at 6 to 8 weeks after surgery. If I put your implants underneath your muscle because you had very little coverage or very little breast tissue, then you really want to avoid some of those exercises kind of long term. So those are the exercises we just talked about. Bench press, push-ups, burpees, anything that really engages your pectoralis muscles, because whenever you do that, you're pushing your implant down and out, and it's just not going to maintain your results long term if you really focus on those exercises. Doesn't mean you can't work out, doesn't mean you can't do upper body stuff, it's just you want to avoid those ones that really focus on the pectoralis muscles. I think that really covers it. And then the last thing to say is returning to exercise is super important after surgery. So after your recovery, to maintain your results and have good long-term results, you do need to get back to a healthy diet and an exercise routine. Don't be stressed out about if you had a BBL, about losing everything that we grafted. The fat that we graft to your butt is typically the stubborn fat that's around your belly. And it's not the first fat to go if you lose any weight. And so you want to look to maintain a healthy weight. You know, most patients actually, their healthy weight after a lipo 360 and a BBL should be lower than where we started, because we don't graft all of the fat that we remove. So your new baseline weight should be a little lower, and you want to maintain around that area to get the best results long term. All right, with that being said, do we have any questions, Willie?
Yes, we have. Let's start. When you get a breast lift and reduction, does your boob lose its round, nice shape after that?
No, so it can in the short term, because they may be a little boxy right after the procedure because everything's really tight. But as your tissues relax, you're going to get back the natural curve and roundness of your breast. So that's normal in the first few months after surgery to have a little bit of blunting and flattening of the lower pole of the breast. But as time goes on and that scar tissue softens up, it's going to get a nice round shape.
I'm considering having a BBL, but I don't know the timing for the recovery. Is it true that I can't sit for 6 months?
No, that is not true. So the strict rule is the first 2 weeks after surgery, 0 sitting on your bottom at all, even with the BBL pillow. Then after that, from the 2 week to the 6 week mark, you can start sitting for short stretches using a BBL pillow, which is a foam cushion that goes underneath your thighs, and it offloads the pressure from your buttocks. And so after the 6 week mark, you can start sitting again, and you want to, limit it a little bit. But at that point, whatever fat has survived the grafting process is there, and it's good, and it's not going to go away with sitting at that point. So not 6 months, 6 weeks.
6 weeks. Do you combine tummy tuck with a fill into the hips?
Yes. So in general, I do not combine BBLs with tummy tucks. Reason being, the recovery from those two procedures is different, like what we just talked about. You have to stay off of the grafted fat to the buttocks. And when you're recovering from a tummy tuck, you're going to be a little hunched over in a reclined position, and you can't be on your belly recovering from that the whole time. With that being said, for patients that strictly have some areas of the hips that they want to improve, you can keep the pressure off of your hips and recover from a tummy tuck. So for the select right patient, we can do fat grafting to the hips at the same time as a tummy tuck.
Okay, Doug, how do you pronounce your name?
It's Dr. Wiegriff, Garrett Wiegriff, and so kind of how it's spelled, Wiegriff. And I'm not offended if you mispronounce it or you call me Garrett or anything else. So
Dr. W?
Dr. W's fine. Take no offense.
I have hip dips and I don't know how to fix that.
Unfortunately, I'm the guy that has to help you fix that, because hip dips is an anatomical area where there's skin and fascia. There's not really muscle in your hip dip. So it's not something you can train and improve in the gym. You can lose weight and you can build muscle. Those are the things you can do to improve different parts of your body. But your hip dips, if you were genetically just born with it and you don't have fat there, you can't preferentially gain weight in one small area unless I go in there and graft fat into it to help improve the contour of those hip dips.
Okay, and I have a last question that said, I'm a mom of 2, 3, and 2 years. Can I have a tummy tuck? But the thing is, what happens if I get pregnant in a few years later?
So this is a common question, and it's a great thing to think about. If you're really sure you want to have another kid in the near future, another child in the near future, you should wait to have your tummy tuck till afterwards. The reason being, your results may go backwards after having a child, and we may need to redo a tummy tuck. But if you're unsure about the possibility of children in the future, and it's going to make you more comfortable to have it done now, let's do the tummy tuck It's not going to prevent you from having a healthy child again in the future. We just may need to touch up things after the next baby.
Okay. Oh, the last one. No, if someone has, just in time, if someone has a little volume to their butt but doesn't want a BBL but have hip dips, can you fill in the hip dips and see the change?
Yeah, absolutely. And so, you know, everybody's idea of a BBL is different from person to person, and what your goals are, I'm going to help you achieve. So if you just want to help smooth and round out things a little bit, we don't have to go crazy with the fat grafting. We can keep a nice natural result and just enhance your natural shape and curves. All right, everybody, thank you so much for tuning in. Please go check out our website at pureplasticsurgery.com if you're interested in a consultation, and I will see you next week.
Bye bye. Bye bye.